Dr. Paul Johnson said earlier we have 3 NMC presidents and this other guy. I'm the other guy in that group. So they don't have me up here because I'm the eye candy. They have me up here because of those 15,000 herds that Reed said are going to survive, I work with more than my fair share of that group. And so I'm going to talk to you about what I see in my client herds and try and give really practical udder health management advice to you guys. So Dr. Andy Johnson gave us our marching orders, and we've been talking a lot about it among the speakers, and he assigned me 6 topics. And there's a couple of things I want to point out in that. One is that any one of those topics could have made a 30-minute presentation pretty easily. So this is going to be a little bit like speed dating. You're going to get a few quick hits, and that'll be it. The second thing is they're all immunology topics, which I don't know if Andy Johnson knows me or not, but there are people who are qualified to speak on immunology, a couple of heavy hitters in the veterinary field sitting out in the audience. I'm not really one of them. But then I remembered what Andy and David Reed taught me, and they said, don't worry about the data. Don't let that get in the way of your clinical perception. So we're going to be good. When I went to vet school, I went to Minnesota. Some of you know some of the faculty that would have been there at that time, but one was a guy by the name of John Fetro. And he told me, he said, in vet school, X% of what we teach you is going to be wrong by the time you get into practice. What he didn't tell you is practice is basically solving for X, right? You're figuring out all those things that you were taught that are wrong. So we're gonna challenge some perceptions maybe that you guys have heard over the years. And the truth is about all of these things, the answer is it depends, right? But that's the cop-out. So we're gonna get deep in the weeds about the depends part. What that list of 6 topics didn't do is let me talk to you about the fact that I think really matters when it comes to milk quality, or really anything on your dairy. You could pick repro, fresh cow health, doesn't matter. And it's these people. These are the difference makers. I don't work with a single dairy that fails to achieve their goals because they don't have enough knowledge or don't have access to enough knowledge. They might not listen to it. We've talked about that. Or they might voluntarily say, we're going to break those rules. The most common phone call I get from a producer is, all those things you've been talking to me about, I'm getting ready to break one of those. Help me do it so it doesn't break me, right? So there's a sense of reality there. But I think Andy's going to talk a little bit about people, but they're the true difference makers. 2023 data, I don't have any newer than that, but 181,000 cell count. So a couple things, the reason I put that up there. One is, if you're sitting out there and your cell count is higher than that number, you're below average dairy. You should just be honest about where you are. It doesn't mean you're bad, you're just below average. The second reason I put that up there is we've been trending down for a long time. That is going to change. We've changed how we cull cows, and that will change the somatic cell count. And I see it across my producers in the co-op. The reality is we're pretty good at managing cell counts, not necessarily as good at managing clinical mastitis or new infections. So we can manage our way out of it. So question 1, how do I manage high cell count cows and clinical mastitis at freshening? And I don't know what Andy was expecting here, but I'm going to do a tale of 2 cows, okay? You cannot answer both, okay, because every dairyman wants to milk every heifer that they see. But I've got 2 cows. They're 30 days fresh, both of them. Cow A had a log 1 of 2. Cow B had a log 1 of 4, which is roughly 200,000 somatic cell count, log 1 being their first test. Which one is it that you guys want to milk, and why? Anybody going to jump out there? Cow A, right? Because inherently we know that while we always thought, oh, it just gets better, that doesn't matter, that first test matters a heck of a lot, okay? Those animals, much higher risk of having clinical mastitis, obviously much higher risk of being a chronic high cell count cow, much higher risk of becoming a 3-teat, and overall, much higher risk of being removed from the herd, okay? The first test matters. How we navigate the transition period, and Dr. Hutchins will talk to you a lot about the nutrition aspects of that. How well we do with our transition cows when it comes to milk quality sets the tone for the entire lactation. and it sets your risk profile because the animal with the log 1 of 4 has a much higher risk for you. So the same management applied to that cow is going to get you very different results than the same management applied to the animal with the low first test. So what do you do? What is the appropriate way to manage these animals? And the answer is cry, right? There is no other answer. We should be, it's a loss. You've already incurred the loss. You can't change the loss. So then when you're done crying, the thing to do is stop tolerating poor results. If you are not looking at the first test, if you have that data, if you invest in DHI tests, and even if you don't, we can still do CMT testing on cows. There are other ways to get some of that data. It's a huge driver in your bulk tank somatic cell count and your milk quality success. You're either setting yourself up for success or you're setting yourself up for failure. And where I see it the most is what we'll tolerate in lactation 1 animals. I look at herds and you see your lact 1 animals with higher log 1 scores than we do lact 2 and sometimes lact 3. And that should never happen. My grandfather, I grew up on a small dairy in Pennsylvania, and he had a saying. He said, the udder never gets any higher and the cell count never gets any lower. And you should think about that for a minute. If we start out and we break the heifer right out of the gate, what does that do for us for the rest of the time that she's going to be in the herd? Over the herds that I have a chance to look at their management long-term, if I were thinking about building new facilities right now on a dairy, they would be for transition cows. Because if I get that right, the rest, I'm not going to say it doesn't matter, but I got a whole lot more latitude with the rest of the lactation. If I can get through that fresh period, the peak period, my late lactation cows, especially once they're pregnant, I can get by with a lot more. I'm not going to really talk about treating fresh cows. We might talk about that more when it comes to chronics. I get pressure, especially right now, given the heifer market. Not a lot of availability, really high price. Should I treat some of these animals? You can. You just have to be realistic about what the results are going to be. So my verdict is, it's really not about managing these cows. It's just acknowledging that you have a weakness and doing something about it. The pain of change has to be less than the pain of staying the same. So this has to be painful, and it is painful. If you stop and look at it, it's hurting quite a bit. I've often theorized that you could segregate these cows if you had a big herd and manage them differently. I think that's possible, but I'm not sure it changes the outcome. So practically speaking, we don't really do it. I heard a couple mentions in my colleagues' earlier talks about blanket treatment versus selective dry cow therapy. Anybody doing selective dry cow therapy currently? I've got a couple clients. Reasons to do it, it is the right thing to do. We're not going to get any new classes of antibiotics. We should be very judicious about how we use them. Theoretically, it reduces the risk of residues on your dairy. I say theoretically because now you've got animals that are treated and animals that aren't, and you've got to keep those straight in both your records and however you're going to mark cows. I don't think the reason to do it is because it's going to decrease expenses. I don't see that practically on dairies. So if you're going to do it, it's going to be for one of the reasons I listed above there. But I've had pretty mixed results. I'm just going to be open and honest with you guys. I've got dairies that have been, I think, great candidates for it, and they're generally not that interested in it because they're already doing really well, and they don't want to change things unnecessarily. The dairies that I have had come to me about it aren't good candidates. Generally, they're dairies that their milk quality, they've got a lot of other low-hanging fruit that they could take advantage of, and this isn't one of those things. And when I go to a dairy and start the conversation, most often what has happened in my experience is when I get to the part about saying most cows that dry off aren't infected and we don't have to treat them, they hear don't treat any dry cows, because most of my clients are Dutchmen, good Dutchmen, and they're always looking for ways to cut expenses on their dairy. That's why they've been successful over the years. And we end up in a period of time where we're not treating any dry cows. Milk quality gets significantly worse, and then we go back to treating all dry cows. So I've had mixed experiences. But what this would look like for a dairy that would consider it, we're going to separate into two groups. I like to use teat sealant, whether I'm dry treating or not. I think it's very effective. There's plenty of research out there to say that the ROI, the payback, is really good. And again, we talked about the effect of new infections over that dry period, okay? So teat sealant is almost a must, in my opinion. Now, we can debate whether you want to use internal or external, or even both. I've got clients who do both, so, but we're gonna use that. So one group is gonna get treatment and sealant, the other one's gonna get just teat sealant. That creates one risk, okay? If you're gonna do internal teat sealant without antibiotics on top of that, you've got to be damn clean about your infusion techniques. Where that doesn't work very well is if you've got a large dairy and you want to have everybody gang up and start drying off cows, because I can't train 10 people to be good at doing a dry off procedure. I can train 2 or 3, right? But if you want to just blitz dry off with a lot of people, I can't get a whole team of them to be that clean. Then there's some logistics thought here. So how far in advance do you need to know who those groups are? Do you sort them? Are you going to work them differently? Marking, like we talked about. How you pick the cows that fall into those groups is probably the biggest pitfall, but it's a manageable one. Certainly there are different schemes, we'll talk about it. And it's all about your risk profile, right? Are you willing to treat a few more cows to make sure you get all of the infected cows? Or are you willing to accept that you might miss a few infected cows and lower that number a little bit further of how many you treat? So options that I've used on dairies successfully. Option 1, all cows, somatic cell count greater than 200, last 3 test days, or any clinical mastitis event, this lactation. Option 2, there's variations of, but we're going to use some different somatic cell count thresholds. And some idea of X mast greater than 0. So if you had a mastitis, you're going to end up on that list either way. Both of those options, I'm really good with having Dairy Comp or your herd software run that list for me. In fact, Dairy Comp, at least if you give them a decision tree or a flow chart, they will make that decision for you. They can automate that in the background. Option 3 is the one that you hear about most in research. That's going in and culturing the animals 24 hours ahead of time. And then using that in some kind of combination with cell count and mastitis. I'm not a big fan of that. It doesn't work well for my dairies. Logistically, it's a challenge, and I think it's probably not the best diagnostic for me. Justine could speak to this, but a lot of subclinical mastitis cases, in my experience, end up being no growths. And so I'm not sure you actually are finding the cows that you really want to find. So I haven't used that a lot. If you're a smaller dairy, absolutely. This is the one most commonly talked about in the literature. Perfectly acceptable, just hasn't worked for my clients. This is an example decision tree. They don't have to be this fancy, or maybe you don't think this is fancy, but I like doing decision trees. My people like visual things, and this helps them navigate it. One of the big pitfalls that I think dairies go through is not wanting their people to make decisions. So we're coming back to people again. I don't have a way to scheme a dairy so that nobody ever makes a decision, right? So you just have to train your people and give them a framework so that you make the same decision I would make and that Andy would make, and then we can look at, are we making the right decision? If everybody's making different decisions, you don't have that opportunity. Marking is a big deal. Keeping them separate is a big deal. It comes around when you have fresh cows that just, they've got issues and you want to call them and don't remember what group they're in. How can we monitor our results? I think everything is a lagging indicator. Dr. Britton talked about that. It's hard for me to say Dr. Britton because I think of your dad, but it's all a lagging indicator. So by the time you figure out you either missed that cow, you didn't treat the right cow, you've already got her back fresh, right? So monitor log ones over time. I like CMT. It's there's pluses and minuses to that diagnostic, but certainly if you do dry and fresh CMT and you record it, that's true new infection, right? Because there are some cows that cure 1 quarter and infect 1 quarter over the dry period. Being open and honest, CMT only flags pretty high somatic cell counts. So you're not going to have sensitivity in that 200 to 400 somatic cell count range. You're just not. Even at maybe 500 to 700,000, it's kind of gray. I was never really good at reading radiographs. That was the lowest grade I got in vet school. So reading a CMT is kind of like that sometimes. But it's still a good test for what it does. One piece that I think is relevant here and does tie back to what we talked about with fresh cows. If we're freshening cows and putting them in the hospital, I think that's a huge risk for our milk quality on those cows. If there's one place on a dairy to go and get sick if you weren't already sick, it's the hospital. So whatever strategy you're doing, I would try and find a way that we don't divert those cows through the hospital pen. So what's my verdict on it? It's all about the people making the decisions. The dairies that I've had be really successful with this, they've got good people applying those programs. We've got good ground rules. We track results very well, good communication. So if you don't trust your people, if that second slide I showed hit home for you guys, this program is probably not for you. Does it make sense for your dairy? If your milk quality is pretty good already, I think it can make sense. If you've got a lot of other, things hanging out there that are real bottlenecks in your milk quality program, probably not an area to skimp. If I know I've got Staph aureus running through the herd, I'm not going to want to give up my dry cow treatment, okay? Treat or no treat clinical cases. Man, tossing the grenades out there, Andy. So I have an opinion, like on most things. Who wants to jump out and say which is the best mastitis tube? Probably you guys have used them all, or gals. Anybody very passionate about one or the other? So while you're thinking on that, something happened 9,000 years ago today, back when Andy was born. Anybody know what that was? This happened. We took this cow, the auroch, and turned it into this cow, what we know today as the Bos taurus. And I'm not the smartest veterinarian in the room, but I do know one thing. That tells me that mastitis is at least 9,000 years old, right? And antibiotics weren't invented till 1920. So cows have been curing mastitis without antibiotics for a whole lot of years. Don't hear that as don't treat any mastitis. Hear that as not all mastitis cases need to be treated for the cow to cure. In pharmacology, they talk about something called number needed to treat, right? How many do I have to treat to change the outcome of one animal? I don't see that a whole lot when it comes to mastitis tubes or dry treatments. So again, how you make these decisions and how you use the products is going to mean more than the product itself. A couple of things I still hear out there. There is no such thing as a stronger tube. Either your drug is effective against the bug or it isn't. The issue that we have in the field with getting success with treatment isn't that the antibiotic isn't effective. In a lot of cases, I'm not going to say never, but it's a lot of times getting that drug concentration high enough where the bug resides within the udder tissue. Okay, so keep that in mind. This is why chronic high cell count cows, the success rate on treating them is pretty low. Duration of therapy, that's a tough one. There are indications at times for extended duration. I just don't think it should be every time. I don't even think it should be most of the time. I think if you're working with your vet and there's a use case and you think that's really making a difference for you, fine. But practically all I see is that's adding a lot of cows to the hospital pen. Not all treatments come in a tube. I do think that's true. A lot of research out of the EU, we're not pro pain management here for some reason, but that pain management really makes a difference in some of these case outcomes as well. I don't think there's much cause for systemic treatments in anything but grade 3 mastitis, systemic mastitis, and even there you're treating septicemia more than you're actually treating the mastitis itself. And the data in the research would suggest that frequent milking and oxytocin doesn't change the outcome. So choosing the right cases to treat, we can agree on that, hopefully means more than the right tube. It's not the drug that you choose, but the people who are guiding the use of that drug. Hopefully that's your veterinarian included in that, herd managers, and the boots on the ground, right? We talk about it as where the shit hits the man. That's where these battles are won and lost. So again, vet school wisdom that was imparted on me. There are 3 types of cases that you're going to see. Those that are likely to cure no matter what we do, and our job is to simply not get in those cows' way, let them do their thing. Those that you're never going to cure no matter what we do, and we shouldn't waste any time or resources on those. And those where we can actually improve the outcome with treatment. That's that number needed to treat concept. And that's where we should focus most of our effort. The key here is, how do you pick which cows fall into which category, right? That's the secret sauce. I think CalSense makes some real sense here, not to use a pun, but we know that young cure better than old. I'm finding that out now. There's some truth to that. So you heal quicker if you're young. Stage of lactation, we have better success with treatment at 2 different time points. One is early in lactation. The other is right at dry off. Okay, so don't forget about that. Any history of prior treatments? Absolutely. History of prior clinical or subclinical mastitis, even if it wasn't a treatment. And here's where records really come in. Are we recording our mastitis cases that don't get treated? Okay, it can't help inform decisions if you didn't record it in the first place. So we really should be doing that. And then I highlighted this one at the bottom. These cows scare me. I run away from these cows. They're likely to be bad things. And again, if you just think about odds, if I've got a cow with multiple quarters, what are the odds of getting a clean cow at the end of that treatment? Whatever it is for a single quartered cow, it's going to be a half or a third, right? Or maybe in a quarter, maybe. They're not good. Let's agree on that. So these cows, I flag them really quickly, and more times than not, it's some pathogen that's not something I want in the herd. So I try hard not to treat multiple quarters on the same cow. How about diagnostics, right? Justine gave a good talk on that. This is the diagnostics that my dairy producers like to get into. And this is the cleanest diagnostic I've ever seen, because it tells you immediately exactly what you're looking at, right? Cold beer versus the warm beer. So I do think there's a lot of place for on-farm culture. I think there's a limit to what you can do with on-farm culture, and we should be honest about that, where that line lays. Justine talked about not doing bulk tank cultures, not doing bedding cultures. I agree with that. I'm not a huge fan of speciating at the dairy level, although depending on what diagnostic you are using, that gets more or less possible. I don't think PCR has worked well on the dairy. I've had really negative experiences with that, and we can talk about it, but I've got enough case studies now on large dairies to show that we miss a lot of animals, and so I'm not real comfortable with doing that. And quite honestly, the level of scientific technical skill that requires, we're just not going to have at on the average dairy. So I'm pretty good with basic biplate or triplate. If you want to add in a coag tube or something to help you with Staph aureus diagnostic, fine. I prefer using the chromogenic augers. Personally, my people, that seems to do better, with the exception that some of our teams are colorblind, and you should understand that. So if you're looking for colonies that are green and you've got somebody who's red-green colorblind, hopefully they're honest and like, I can't see that. But it has happened to us on dairies. I think there also are ways to choose these cows, whether you are doing culture or not. I think you can make some decisions on which cows to treat. In general, in my framework, I am choosing to not treat gram-negatives. I think there's not a great case to say that's hugely beneficial. I don't treat no growths. I do believe treating gram-positives, I can make a difference, with the exception maybe of Staph aureus is not going to be real responsive to treatment, maybe lactococcus as well. How do we manage chronic, clinical, and high cell count quarters? I find this one hits a lot of producers between the eyes. There is no instance over long term where you will have 100% cure rate. I say no, maybe strep ag if you treated everybody, but even then I don't think so, right? So you're not going to get 100% cure. So what does that mean? That means if you make 10 new infections this month, you're probably only curing 9, or maybe 8, maybe 7. So your dairy is manufacturing chronic cows every month, probably every week. So we're going to have to manage them. Whether I have lots of dairies tell me, well, I don't manage milk quality at all. I don't do anything. Well, that's false. We do. Everybody does. So they happen, and it doesn't matter. The treatment only increases the cow's ability to cure, right? It only ups the chances. But if the cow isn't capable of curing herself, it doesn't matter what you treat her with. It's only a support. So the secret obviously is create less infections, right? That's the only way to manage this. We have to be better at lowering that new infection risk. There's a lot of ways to do that, but it comes back to the basics, right? Lay cows down on dry, clean bedding, milk clean, dry teats at milking time. Those are two of the biggest ones. And unfortunately, those are the two of the ones we break the rule on the most often, right? So we've got to be consistently good at the common things. The consistently part is the part that's underlined. I've got dairies that have very good procedures. In fact, many of them have really good procedures written on paper. But there is a difference between a procedure and a routine, right? Most of my dairies don't have a good routine, meaning like they can't execute the protocol they have on paper consistently. And that's true. Once you make a chronic cow, there's not a lot of great options, and most of them are going to be Band-Aids. I listed them. In medical terms, benign neglect, right? We can treat, but treating chronic cows is not a very rewarding process. It can be a tool, depending on the situation, if you're being honest about what to expect the return to be, but we could treat them. We, for ages, have culled the cow. You can cull the quarter, otherwise called three-teating. Risks that go along with that, right? You're still keeping that cow in the herd. That cow can still leak. You might milk it when she comes fresh the next time, all sins that we shouldn't do, but we know happen. And we do get our best cure rate on these chronics over the dry period. So good repro programs actually help support good milk quality programs because we get those cows back in the dry period sooner. Famous veterinary quotes, Dr. David Reed. These, by the way, are all injection site lesions, okay? So I'm taking a little poke at us as beef producers. And by the way, we are all beef producers. My producers now are cow-calf guys. We're in the calf market. We're in it hard, so we'll talk about that here in a second. So in food animal medicine, we eat our mistakes, and I think if dairies took that to heart as well, we would fix some of our cull cow welfare issues, right? And think about it, and I see Mike sitting back here. Think about it in terms of how much revenue are you getting out of that cull cow stream? Are we making those decisions early enough on those cows? I have no idea what involuntary culling is. You make a decision on it. I lived in West Texas for 11 years, right? This is the only involuntary culling. It's cattle rustling. Otherwise, it's a decision that we make. Are you making the right one? And are you doing it at the right time? If you look at why cows leave dairies, I think we're fooling ourselves because a lot of poor production comes back to mastitis, comes back to lameness, comes back to those other issues. And the research and experience would say that we're really poor at coding those cows on dairies. So when you go look at your car codes, in your records, we're not getting the right codes on those cows. All cows leave for poor production. Ultimately, it's an economic decision. So I flew down here Sunday, and while I was sitting in DFW, I saw this come across my phone. I think it's pretty close to home to what I hear from producers. Everybody in my network is trying to cut their cull rate back, which is cool. I like that. Do you know what the problem with that is? The cows we're culling, we're not culling them out of convenience. I know we could debate that, but the cows I see leaving dairies on trucks are broken in one way or another. That's why they're leaving. So if you want to bring your cull rate down, guess what? You got to get better to do that. You got to break less cows. Heifers aren't that plentiful. You can still find them if you got the cash, right? You got the money, I got the time. But they're not plentiful, and dairies are looking to hold on to their cows longer because every uterus is a huge economic advantage. So it used to be, I see lists of DNBs on dairies. There are no DNBs anymore. We're breeding everybody, right? We want those cross calves. The problem with that is when it comes to chronic cows, there's this thing called critical mass. Staph aureus would be the great example. You can screw around, you can keep them in the herd, you can keep them long enough, and someday you cross a threshold and it blows up, right? Because you get enough cows, you get that transmission amplified. I have seen more than my fair share of blow-ups in the last 2 years, and I attribute it some to that. We're breaking a lot of rules with culling. The other is one thing that Justine hinted at, and I talked to Dr. Paul Johnson about. When he was in his heyday in practice, we knew how to control Staph aureus. If you go back and look, there are lists of practices that control Staph aureus, and now go through and take a marker and say, how many of those are we still consistently doing? And the list gets pretty short, pretty quickly, to the point where you remove one too many safeties, and now the gun suddenly goes off by accident. So we have to be honest about, how many of these rules are you breaking? There's no rule you can't break, but some you will pay more for breaking than others. So what's my verdict here? I'm not a gambler, but I know some people who are, like Gordy Jones, and he's taught me a thing or two, and this is the worst hand you can draw in Hold'em, right? The 2-7 offsuit, right? The lowest odds. I'm predicting we're gonna make some decisions against the odds in the next few years because we're cow-calf producers, because we're gonna hold on to cows longer, because we wanna cut those cull rates. We're gonna violate as many of these rules as we can. We wanna get away from having more labor, so we're gonna put in teat sprayers that get 50% coverage on a good day, and we're willing to tolerate 30% more teat dip use for 50% of the coverage, right? By the way, teat dip coverage, if you missed it in her slide set, big factor in controlling Staph aureus mastitis. So, the puzzle pieces fit. It's not a new emerging disease. We've just made conditions right so that it can make a comeback. The calls I get are like I said earlier, I'm gonna break this rule, help me have it so that it doesn't break me, okay? So they gotta be calculated risks. And that means we gotta get better at not breaking cows. We just gotta have less cow disease. We gotta have better transitions. All of those things have to be true. I laughed at this one when Andy sent it across for a couple of reasons. One is just the general vaccine discourse in this country right now. So Andy said, hey, do we really need these core antigen vaccines if we're not finding any gram negatives? And so I couldn't resist. I think both political parties are beyond screwed up, so I'm not one side or the other, but I thought this one was really appropriate. About 8 years ago at a veterinary meeting, I had an old beef veterinarian with a really cool mustache. You guys might know him. He came up to me at the bar, and he just, a few words. He said, if you had to give up all vaccines except for one, which one do you keep? And I sat and I thought for a moment. I was like, man, I don't know. And I ended up with clostridial vaccines, which I guess, I don't know how you feel about that or not, but his point was that we probably over-vaccinate, and that's true. I think more dairies over-vaccinate than under-vaccinate, and there is a cost to doing that. But Andy, seriously, my dairies are very different than yours, but who has no coliforms? Raise thy hand if you have no coliforms. And if you raise your hand, I'm gonna pick on you because I'm gonna ask, how hard are you looking? And does your bulk tank agree? Meaning, like, if your co-op tests your milk for coliforms, are you gonna find 0? I don't think so. Hopefully it's under 100, but still, I mean, we're awash in a sea of manure on a dairy. There's gonna be coliforms around. We do a good job of managing it. There are good dairies that their culture profile is heavily skewed toward gram positives, but no gram negatives, never? I don't know where that utopia is, but I would like to know where those dairies are. The dairies I work with are more in this camp, right? We're a managed chaos situation. Whenever a dairyman tells me every time, never and always, I know it's a lie because we're just not capable of doing that. So dairy life happens. We have bedding issues that happen. Either we don't have it or the quality is for some reason compromised. And that happens, it doesn't matter, sand, manure, solids. We're in the Southeast, so there's sawdust packs and things like that. So availability, variability, that happens. Manure issues, flush system went out, that vacuum truck is down, whatever it might be. Water issues, we have, like, a lot of my producers are in the high plains, so we take whatever water we can get, even if you gotta cut it with a knife right? So water is a big issue. Employee turnover. Who doesn't have any employee turnover, right? How much damage can one new milker who doesn't know what they're doing in the parlor do? Quite a bit. Overstocking and heat stress. There's no heat stress in Georgia, right? Okay, I was just checking. So in my life, when I got to make hard decisions, I do just a side-by-side table, pros and cons. And I think this is a good one. You can be open and honest about it. I'll do the cons first. The obvious is you got to pay for the dose, and you got to pay for the labor to get it in the cow. On average, we're being honest, we probably over-vaccinate our herds, and it can get pretty hard to incorporate some of these vaccines in the program. Meaning like you got to balance your gram negatives and your antigen load in those cows because they can be harsh. And I don't know if anybody in the room has ever gone in and done a whole herd vaccine program on one of these core antigen vaccines. And I don't think it matters which one you pick. If you go in and vaccinate the whole herd, you will see the effect in the bulk tank. I learned pretty quickly that's a last resort. You don't go in and do that very often. So there's an impact on our cows to doing this. We shouldn't deny that. The pro is, I don't know of a time in history where the value of a cow has been more, right? These are really valuable animals. They have the intrinsic value, like we all dairy because we like cows, otherwise we'd be in some other business, but they have an economic value too, and you got to be honest about both. I'll say relatively effective at what they do, okay? I don't see huge amounts of evidence to suggest that core antigen vaccines actually prevent infections. I know there's some out there, but in the whole, I don't see it. What I do see, and I think has been proven out many times, is they're very good at reducing the impact of those infections, meaning the severity of those cases. They're very good at that. They save cows. John Fetro, way back when, did a paper when these had just come out in the early 90s and looked at the ROI on these. And when you look historically, the only thing outside of these in animal agriculture, I should say cattle, that had a bigger payback was implanting beef cattle. Okay, so it's pretty good payback. You don't have to save too many cows to pay this back. So I think it's a strong ROI case even in today's markets. So what's my verdict? If I had one cow, I think I'd still use them. I definitely would. I'm not sure I'd do the hyperimmunity route. You know, you start getting in the lots of doses in a lactation. There is a use case for that. If you had a lot of coliforms in your herd, I think that makes sense. I think I would use a couple shots and I'd try and focus them around fresh and peak. Okay, we're getting down to the end, and I'm going to finish on time, Andy, so no bullshit from you, okay? New immune stimulating products. Andy tossed this one out there. Do you know who this guy is? Barry Bonds. So the first thing I thought of when he said immune stimulants was performance enhancing drugs, right? He's the poster boy for that. And somehow we took this was minors, pros, this is towards the end of his career, so it doesn't even look like the same person. And then I thought, well, PEDs isn't right. Maybe we should call it IEDs, and that's immune-enhancing drugs, but that's already taken. Those are landmines, right? So we're not going to call it IEDs. So I found this in my collection at home. I collect dairy antiques and collectibles. Who was around for the launch of Imrestor? I'm dating myself a little bit, but it gives me some street cred, I think, so I'm going to do it. Huge launch, put it out there on a lot of dairies in a lot of regions, not a lot of results. And it has nothing to do with the idea not being sound. The idea is perfectly sound. They use it in humans undergoing cancer treatment. The idea is put more immune cells into circulation. But it's not as simple as that. Because you can put more immune cells into circulation, but how do you get them trafficked into the udder? Right? It's a semi-immune privileged organ. So how do we get those cells going to the udder? And then I always thought this, and I don't know if it makes sense to anybody else. If the low-hanging fruit is not having enough leukocytes in the udder, then are we wrong that somatic cell count can get too low? And I do not believe we're wrong there, okay? So I don't believe, the idea was sound, but I don't believe it was ever going to work. Does that mean no immune stimulants will work? No, it doesn't, but it does mean that we've been there and done that. I think if there is a future for immune stimulants, it's something similar to this product. Maybe you guys have never seen it. It's a beef product. It's DNA and they're using it to create what we call mucosal immunity. So they're exposing the animal in the mucosa where she's going to be exposed to the true infection, in the upcoming period. Most of the teat's defense, or the cow's defense to mastitis, is going to be the teat. And it's going to be the teat sphincter, okay? Again, Reed talked about looking at teats, teat damage being a big deal. It's a huge deal. Teat skin damage is a huge deal for Staph aureus. Again, Staph aureus is all over skin. The more you damage it, the more you have. So I think if we're going to see some kind of immune stimulant be used for mastitis, it's probably going to be this. My question to you is, I said earlier, our cows are awash in a sea of bacteria on a dairy, right? One of the reasons I don't think we see as much resistance to antibiotics is because one strain that's resistant can't possibly take over because there's so many bacteria on a dairy. So if our cows are getting exposed to that level of bacteria, do we think some more stimulation is needed, right? Aren't they getting stimulated enough already? Now, if what Andy meant and what you're thinking is, do we want some kind of immune supplement? That's a different discussion. I think there are individual cases where one of these might make sense. Pick your one that you like. The question is, if you make a big difference across a lot of cows with one of these, what does that say about our nutrition program? It probably means we're not supplying the nutrients that we need. And I'm not talking about individual cows. You get a cow with a retained placenta, absolutely, AE and D might make a difference for that cow. MUC might make a difference for that cow. But if you're talking about populations of cows, shouldn't we just be feeding them to meet those needs? Who knows this product? I travel a lot, and my wife gets super angry every time I bring disease home to our household, and it happens more than my son who's in preschool, sadly. And so I'm pretty religious about taking this product. I believe in it. Story here, because I've got 3 minutes to burn. My great-grandfather had arthritis really bad, and he believed in his heart of hearts that if he sprayed WD-40 on his joints, it made it feel better. And he would show you the can and said it loosens stiff joints, right? Honest to goodness, this is the stock that I come from, right? So I take these pretty reliably, and I feel like they make a difference. But if you look at the science, they don't make a difference, all right? So keep that in mind. That science is in the eye of the beholder sometimes. Another question I have here is, if you believe that we have to stimulate the cow's immune system, in my mind, what I hear you say is the cow is the weakest link. And I don't believe that. I don't believe that. And when we think about disease, it's a balance between exposure and immunity. And we're saying, hey, we need to up this immunity, right? Maybe we need to lower the exposure. And I'm not against doing both, but I think we should take some accountability for the reason we have mastitis in the first place. I am agnostic to brands. I don't care, but probably one brand that's in the trade show will like at least this take that I have, which is we are the cause of disease. And a lot of it is stress related. If you think about the animal's lifetime and the periods when we have disease, it's all related to management practices that cause stress for various reasons. So if we could manage stress better, what does that do for our occurrence of disease? I'm just going to leave that one sit there. So my last verdict for you guys is if we don't break the cow in the first place, I don't think we have to have stimulation. And if you want to improve immunity, just look at what we've done with butterfat on cows, right? Genetics can move that needle. It's going to take a little bit, but if we really want to move that needle, we can focus on genes that improve immunity. And so I think that has a lot more hope than trying immune-stimulating products, in my opinion. Please, I put my email up there because I expect you to use it. My task to you guys is go home and look at your dairy differently and try something different. I didn't fly all the way down here to put you guys to sleep. I want you to try something different on your dairy, and if it works, great, tell me about it, and if it doesn't work, call Andy. Thank you, I appreciate it.
One question. Pete, be loud.
What's your opinion on those
PC is not my strong suit. Yeah, it's still there. I've had a lot of dairies try them. When I've looked at the results, I haven't seen strong results. We've offered to do trials on dairies, and that generally hasn't been taken. Like they haven't. That's not something that they've really been that interested in doing. I do understand they've got some trials coming. And the place where I see them used the most in my network, and it isn't a lot, but the organic herds seem to want to use them more. So I'm not ready to say they don't work. I just don't have any data to say that they do. And in my mind, there's certain use cases it doesn't make sense why they would work. So chronic mastitis cows, I don't know. I can't think in my head when you read the ingredient label why that would make any difference in the world. Doesn't mean I'm right. It just means in my little vet brain, I can't connect those two together. It's not logical to me. Can it help support a cow who's got severe mastitis? It might. There's electrolytes, there's different things in there. Some of them have aspirin in. I don't know if they can still sell those or not, but I don't see them a lot in my network. They were a popular thing about 2 years ago, and we didn't see tangible results in a timely manner, and we were paying for the boluses. So mostly the only place they still exist in my world is organic. Does that answer your question somewhat? Okay.